Wellness Coalition is a nonprofit that works within the River Region counties, which is Autauga, Elmer, Lowndes, Macon, and Montgomery. We come together as a group to work with issues that affect individuals that have low income or who are looking for needs within the community. I think the ultimate goal of the Wellness Coalition is for everyone to have access to community resources so that we can have a healthy community. I believe if you teach people what to do when they are in need of a doctor or where to go, then they're more likely to take that resource and actually utilize it. Our case management services, what they do is help people who have a chronic condition and no health insurance find a doctor that they can go to at an affordable cost. They also teach them the importance of knowing when to go to your doctor versus when to go to the ER.
I heard about this program through a neighbor. When he was telling me about this program, I was letting it go in one ear out the other. In the past, I've been able to take care of myself, but I got to where I didn't have an income and I needed some help. And through him steady pumping it into me that this place will help you, this place will help you, I finally decided to give him a call. I learned now that it ain't about the pride, it's just about what you can, maintain and do for yourself.
Wellness case managers are located throughout the River Region counties. They're in the local hospitals, the local clinics, the local health departments, and then we also have some here in our office.
Well, my role at the Wellness Coalition is to help keep people out of the emergency room if possible. And when they do come to the emergency room, is for me to help them to find a medical home to go to. Some people really don't know that those resources exist. And so part of my job is to make sure that they know that they exist and that they apply for them. I think it's important to have case managers at the hospital because case managers can provide continuity of care. If there's an expensive medicine, we can research and find it for a lower price for them, whereas if case managers weren't there in the hospital, they wouldn't ordinarily get the lower priced medication. We're hands-on. The person who does not have insurance, the patient who is having trouble navigating through the healthcare system, the person who may not have enough insurance would benefit the most from the Wellness Coalition case management. Helping people is very important to me. Being able to help them navigate through the healthcare system where they otherwise wouldn't know what resources are in the city or what resources are available to them.
My name is Carol Landreau, and I work for the Wellness Coalition over at Baptist Medical Center South. My role is a healthcare coordinator, which is the same as a wellness case manager. And I help the people who are uninsured or underinsured and need assistance with either having their prescriptions filled when they leave the hospital or the emergency room, or I can help people who need a medical home and think they cannot afford one. Some people only need medication assistance. Some people only need a medical home, and they're good from there. But some people, especially those who have chronic illnesses, may need further help, and I am the middleman at the hospital. I will then link them to a case manager at one of our other locations who does ongoing case management. That way they continue to have a case manager that they can call with any need that they have. There are nurse case managers in the hospitals who know what I do, and they call me if they need assistance. They will let me know when someone is in one of the rooms that needs me to educate them on medical homes they can afford or to offer medication assistance to them. So I will go and visit the patient when I'm called by the nurse case manager. I let the patients choose which medical home they would like to be linked with, and depending on which medical home they go to, that would be the case manager they'll work with. Some people have insurance, but it still doesn't cover everything. There are so many people out there who put off going to the doctor, and they put off their health, and they later regret it. I'm there to provide some help that they didn't even know that maybe they didn't know they needed it. And if they did, they didn't know there was any answers to their problems. I would like to see us at all of the local hospitals one day, being able to, reach out to more people. But I see that more and more people are learning about us, and I know that they tell other people, so the word is spreading. And that's a wonderful thing, to get the word out about what we do, and that way more people will be informed. More people will have their regular doctor or medical home.
I went to the doctor and I had issues about getting my medicine. Not having insurance or afford a certain type of medicine, there was no way. And they told me about the wellness coordination, that I can talk to them and they'll be able to help me get my medicine. A lot of times when you ask for help or something, or sit down, a lot of times people look down at you like, oh, why you're coming here? She wasn't like that. A lot of times we are always scared to ask for help, because I think sometimes it has to do with pride, and we're always trying to figure out, oh, we don't need it, we can do it ourselves. If there's something I don't understand or something that I need, they would talk with me and explain to me, this is the procedure, this is what you have to do. And I appreciate all the things that they do.
I came about a week ago, and they told me, that they could help people that don't have insurance. And it was real hard for me to get money to pay for my medicine. Miss Tony, she helped me got my medication filled, and I thank God for that. I hope she get a promotion.
The Wellness Coalition also have a class called Living Well Alabama. It's through Stanford University. Basically, with Living Well, groups are learning how to manage their chronic conditions by learning how to speak with their doctors, becoming better managers, learning about meditation. And basically, this course is designed for anyone who has any type of chronic condition who would like to learn how to manage better. We have our monthly diabetes classes that we have. We have a nurse who is on staff, and she teaches people how to manage their chronic conditions, especially with diabetes. They also come in and speak with our nurse, and they talk about why they have diabetes, what's the carbohydrate, what's the starch. They talk about all of the components that deals with learning how to manage your diabetes. Whenever the open enrollment season is, individuals can come into our office, and we have certified application counselors that can assist with enrollment into insurance, or re-enrollment if they already are enrolled into the program. After the enrollment period is over, they can still come in, and then we're able to help with special enrollment as well.
I was in need of insurance. I knew a couple of ladies that worked in wellness, so I ended up talking to them about it. It took me through a couple things with the marketplace, and I ended up getting Blue Cross Blue Shield. Everyone in need of insurance, so it's good to have.
In about 1999, I think it was, there were 9 people from hospitals, health centers, health department, mental health, who came together to talk about the problems of people who have no health insurance. That was prompted by Dr. Carol Nason, who really started the Wellness Coalition. Since that time, we've experienced quite a bit of growth. We started out with 4 case managers and 1 executive director and probably a secretary. And we've grown since that time from about 4 people or 5 people to we now currently have 29 employees. We have done a couple of studies in the past. We did one at one of the hospitals where we compared people who had entered case management and the number of ER visits in the 6 months prior to their entering case management and the 6 months after. And we were able to decrease the emergency room visits by 50%, cut them in half basically. If everybody could have a case manager, we'd have a huge decrease in the cost to the healthcare system.
In 2015, the Wellness Coalition provided 6,506 clients with 35,226 services. These services included wellness case management and community health worker services, chronic disease self-management education, diabetes education, crisis intervention, health insurance enrollment assistance, and more. We were also able to reduce the number of unnecessary ER visits by connecting people with the medical home. In 2015, the total value of these services comes to $628,637. We can add to that the total value of medicines we were able to provide, which is $849,664. When you add those numbers together, we provided Central Alabama residents $1,478,301 in no-cost services. Imagine how that value of service affects the community in the long term. From 2005 to 2015, the Wellness Coalition has provided over $21 million in services, but the impact on the community is immeasurable. How do we do this? The Wellness Coalition is made up of what is known as the safety net providers. Safety net providers are hospitals, clinics, and other organizations who provide reduced or no-cost care to low-income and uninsured individuals. The Wellness Coalition serves as a forum for coordinating the efforts of these safety net providers with a singular focus to improve healthcare access in our community. We help the safety net providers by stationing community health workers at their locations to provide the services we've discussed. In addition, we offer professional training on prevention and management of chronic diseases to other organizations and individuals. We also show them how they can provide community health worker services with our community health worker training. The support of the safety net providers is the reason this coordination is able to take place, and the Wellness Coalition is able to offer these services. What we're seeing in the community is ever-expanding support as more and more community health workers are trained and working in the field. It's this system that builds sustainability and ensures lasting change in the community. With our Community Health Worker Program, the Wellness Coalition is able to partner with other nonprofits, no matter what their specialty is, to teach them how to bring a wellness case management component into what they're already doing.
Friendship Mission developed a partnership, really started strong in 2013, where we collaborated with the Wellness Coalition. We really started out doing classes where they were teaching about chronic illness, working with our disabled and our elderly to really teach them how to manage their chronic illnesses. We also attend their case management conferences every year, which has been a really good teaching tool for the case managers in our shelter and for myself as the executive director. And then we just worked with them in other programs. They did some training where we had community health workers that were trained in our facility, which has been another big plus for our employees here. One thing that we feel really strongly about is it helped us to learn how to get medical treatment for our residents without utilizing the emergency room for every bump and bruise. When we first started, one of the first things we noticed is that every time a resident has a headache, if they have a stomach virus, if they feel dizzy, Pretty much everything and anything, they want to go to the emergency room for that. And it's because they don't have a doctor. And so one thing that we had to do was train the residents that that's not where you need to go. Because you end up with a different doctor every time you go. And if you do have a chronic illness, you're going to end up with multiple medications. One doctor doesn't know what the other doctor's giving you. Before you know it, you got a lady on 4 different high blood pressure medicines because she's seen 4 different doctors. Our staff is trained on setting up doctor's appointments, getting them in with a regular doctor, making sure that they're getting the medication that they need, helping us to monitor if they do have a chronic illness. Also, just kind of knowing the boundaries of what we can and can't cross when we're dealing with somebody with their health issues. We see a lot of residents that have chronic illness because they have not taken care of themselves through the years. And so getting them in with a regular physician that knows their medical history, knows what medication they're on, they monitor their medication, that is very important to their having longevity in their life. One thing that we've learned working with the Wellness Coalition is that when a person feels like you care about their health, they're willing to basically let you in the door to care about everything else. And so it's been a really good tool to let us, work with the residents here.
A lot of people go to the ER because they don't have a doctor. And also many people don't have health insurance, and so they don't go anywhere until they're too sick and have to go to the ER. So if you provide a case manager to help them, or a care coordinator to help the person access a medical home, meaning a place that they can go on a routine basis for their care, they tend not to get as sick and have to go to the ER and then maybe get hospitalized.
I've always wanted to be a social worker. That's all I've ever wanted to do. And being able to help is really important to me. And so having a job that I love to do, it's easy. Coming to work every day for me is easy.
I would recommend not only just family, but friends, and not just friends, but if I see someone that's need that help and going through whatever situation they're going through, see if they can help you.
I've always been a people person, and I love to help people. So I do think that this job was meant for me.
Helping people is very important to me. Being able to help them navigate through the healthcare system where they otherwise wouldn't know what resources are in the city or what resources are available to them.
If a person was in the spot that I was in on needing assistance, I would bring them down here myself.